Hi, and welcome to the Anti-Waffle podcast of Em and Pixie.
Woohoo!
And together we'll try to talk about research without any gobbledygook. Each episode we'll be talking to a researcher who will discuss the work they're doing, looking at why this research is important, and asking how did they get into this field. We hope it will be informative and interesting and bring a bit of the academic world into the real world. Today we've got Sudax Murdan, who is an Associate Professor in Pharmacy at UCL. Hi, thank you very much for being here.
Hello, thank you for coming.
Oh, thank you very much. Would you like to start by telling us about your research?
So my research is making vaccines and making medicines. So about vaccines, I'm making vaccines that pregnant women can take to protect the baby when the baby is being born through the vagina.
Right. So the vaccine to protect the baby
Yeah.
and not the mother. So like if the mother's got HIV.
Yeah.
Ah, right.
Yeah. And also, it doesn't have to be HIV, it could be group B streptococcus. So for example, a lot of us, men and women, carry this bacteria in our gut.
Yeah.
And women carry this bacteria in our vagina. And it doesn't do us any harm. But if the baby gets infected, every month in the UK, 2 babies die. And a lot of them get sick. And even if they survive, they have long-term problems.
Wow.
Yeah.
And so which, is this like I know how some women can have like BV. Is that the same bacteria where you get the imbalance?
No. It's
different?
group B
Right.
streptococcus. So women if there is a risk that of this problem, then we give antibiotics during birth.
Right.
Yeah.
I didn't know that. So like as soon as they go into labour,
Yeah.
then we start giving them
If there is a
antibiotics
risk.
straight away.
Yeah, if there is a risk. But it's important to have a vaccine because in many countries it is not possible to give the antibiotic during birth because they might not be in hospital for birth.
Ah.
And
see?
and even
we get so used to the Western world, and it's
Yeah.
just like, oh no, well, obviously you're going to do it in the hospital, or you're going to do it in a birthing pool at home.
Yeah. Or in
But
Africa, where the mother might not attend a hospital at all.
Yeah.
So I want to make vaccines that somebody can take orally. So for example, under the tongue.
Yeah.
It's not injected. So it is. People are more accepting of something that is not injectable in many countries. In some countries, they like injections. But something under the tongue, so we don't need needles, we don't need syringes, we don't need hospital doctors or nurses to administer the vaccine, so it's easier to take. And maybe we could give it to the pregnant women and they take it with them and they can take it later on, let's say, when they go home, if they don't want to. Yeah. Or easier to distribute.
Right.
Yeah.
And is it something that every pregnant woman should take, or just ones that have been identified as a risk of getting this?
I think we'll probably, when we do manage, so there is already in clinical trials a vaccine for this, but it will be injected.
Right.
And once we get the results of this and it goes into practice, it will probably come in phases. Who do we give it to?
Right.
And when do we give it?
So it's still part of the research at the moment, discussing those points.
Yeah. And then once the one that is in clinical trials now gets through, what we are planning is make a vaccine that we don't need to inject.
Ah. So when you, like you were saying, you prefer to do it so like something like under the tongue or something like that. Do you like design the way you will how that bit works as well? So you're not just like designing the medicine. You design.
Yes. So that's exactly what my research is designing something like the preparation that goes in the body.
Right.
So for example, if we want to give something under the tongue, we want to give it so it sticks under the tongue for a little bit,
right.
but at the same time it's acceptable to the person. The person won't say, this is irritant, or this is so thick and it stuck my tongue to the bottom of my mouth. And we want to see whether if we make something that stays there for a bit longer, whether we get a better immune response, whether we get better protection of the baby.
Interesting. So it would just be like, so as soon as they go into labour, then...
No, I think the vaccine...
This is the vaccine.
The vaccine we'll have to give much earlier.
Right.
And then what we want to do, what happens when pregnant women take vaccines, is their body produces immune response and antibodies.
Right, yeah.
And these antibodies pass through the placenta to the fetus, to the baby.
Yeah.
When the baby is born, it already has some antibodies against the bacteria.
Wow. Oh, that's fascinating.
So then the baby is protected.
Yeah.
Brilliant.
So when we give it under the tongue, we get immune response in the vagina as well.
Right.
And then that will stop the bacteria, that will maybe bind to the bacteria so the bacteria doesn't get to the baby.
Right.
Yeah.
It's amazing.
So, okay, so a mother has the vaccine,
Yeah,
then passes on those antibodies to the baby.
yeah,
If the baby's a girl,
yeah.
will that carry on, or do you not know that? Is that something you'll find
We
out?
don't
Will they
know.
keep it?
Yeah, well, that's a
forever?
really interesting question.
Because you could
How
eradicate
long?
it forever.
Yeah, how long will the antibodies
Yeah,
last in the next generation?
yeah.
We don't know, but that would be...
There's your
Another-
next bit of research.
Yeah,
isn't it?
thank you.
Funding,
Thank you.
ding, ding, ding.
Yeah. So in the lab we can do it
Yeah.
and see.
So are you involved in the actual sort of designing of the vaccine as well, right from the beginning, that bit as well?
No, I'm not involved in the designing the vaccine. So I will take the vaccines that somebody else has designed, and then I will package it,
Right.
for example, in a capsule. So, and then we can coat the capsule with a material, with a polymer, and then the pregnant woman can take it,
Yeah.
and the capsule goes then in the stomach. But because of the material that we've coated the capsule with, the capsule does not dissolve in the stomach.
Ah,
And then it leaves the stomach, goes to the small intestine, and again, it doesn't dissolve there because of its material and the environment in the small intestine. What I'm aiming is that when the capsule goes to the large intestine, the colon, then because the colon has a different acidity and bacterial enzymes in the colon that are there because we have bacteria in our other bacteria
yeah.
in our large
So much
intestine,
bacteria.
then the coating will dissolve.
Right.
And then the vaccine will be released in the large intestine. And the reason I want to target the large intestine is because when we do target vaccines to the large intestine, we get immune response antibodies there, immunity in the large intestine, and we also get immunity in the vagina.
Ah.
And this is, so if we have antibodies in the vagina, then they can prevent the bacteria getting to the baby.
Right.
So I'm really looking at two ways of doing this vaccine. One is putting in a capsule, coating the capsule that goes to the large intestine. And a second way is making a preparation that we can give under the tongue.
Right.
Yeah.
Ah.
Right. So I get this straight. So the vaccine's already there. You're working on how it could be administered and how it can be released. And are you also going to? So I suppose if the mother takes a tablet, would she then have to take more tablets in next pregnancies?
That's the other interesting question as well, because we don't know yet how long this response, the immune response, the antibody will last.
So whether the mother takes it once and that's forever, or whether
we don't know.
No,
We don't know.
Fab, it'd be great if it has all those results where it can protect the baby, obviously, and then the mother could have a long immune
Response, immunity,
that'd be brilliant.
Yeah.
And it'd be so useful for, like you say, for people who haven't got access to hospitals
Yeah.
or medical care.
Yeah. So my other part of my research is making medicines. And I've been trying to make medicines that you can apply to the nail for fungal infections of a nail.
Right.
Because fungal infections are very common,
Yeah.
but very few people seem to work in this field.
Right.
It's sort of a neglected area. In addition to working on fungal infection of the nail, I'm now branching out into other fungi. So, for example, I'm working on Candida auris. I want to work on Candida auris.
What's that?
It's a Candida which can infect people on the skin. So, or you can carry it without having an infection on the skin.
Yeah.
Sometimes wounds get infected, and sometimes it goes in the blood.
Yeah.
And it's a quite a high mortality rate. So 60% of people with an invasive infection die.
Right. So this is another kind of like bacteria.
It's a fungus.
Oh, a fungus. Sorry.
Yeah, it's a fungus.
Yeah. Oh. Yeah. Interesting.
And so you're looking at targeting when they get that infection, to be able to put something to target.
Yeah. So what my research is making medicine. So for the nail, for example, I have worked on nail varnish and patches.
Yeah.
And UV gels. Do you know UV gels that you go to nail salons?
Oh, right, yeah.
You apply on the nail and then you put it under UV light.
Yes.
And then the gel becomes a film.
Yeah, so like shellac. Sort of.
Yes. So we put drugs in, and we want to see if when you put the drugs in a nail varnish or patch, the drug is released from that carrier and actually goes into the nail.
Right.
And whether it kills the fungus.
And that will still make you look pretty. So you can wear your nail varnish, so you can sort of almost hide your fungus, but get it treated at the same time. That's such a good idea.
That is, isn't
That's
it?
a wonderful idea. Yeah.
What a good excuse to get your nails done. So how far along are you?
So we've published a few papers on the patches and the nail lacquers and UV gels. We couldn't patent these because of material we used. We used material that was already existing. It was a new material, so we didn't patent it. And I think once you don't patent it, you can't really make a product to sell. But what we did was the research.
Yeah.
The research that lays the ground of how you can make a nail varnish, a medical nail varnish or medical patch or medical UV gel that can be translated, that will turn into a film.
Yeah.
When you apply UV light, and then the patient will benefit from having a film on their nail that lasts for a long time.
Right.
Like a week or two, and then they don't have to apply the drug every day.
Yeah. So is there like other uses that you could use it for? Like, could you use it for not particularly just for the nails, but for, say, if there's someone who has to have like a diabetic or something, and they have to have like regular, like maybe for children.
Yeah. So the nail is not very permeable. So if you put drugs on it, not much of the drug will enter the nail because it's a very good barrier.
Yeah.
So therefore, you wouldn't want to put stuff on the nail to go into the blood.
Ah, right. Okay.
You really only want to put stuff on the nail when the disease is of the nail.
Actually on the nail.
Yeah.
Okay then.
Yeah.
Okay, so can you tell us a bit about how you got to this? Where did you start from?
Right, so I started with a degree in pharmacy at University of Nottingham. Then I did a PhD at the School of Pharmacy, University of London, which is here. And my School of Pharmacy, University of London, merged with UCL. So that's how I'm now in UCL.
Ah.
So after my PhD, I did a very brief postdoc. And then there was a lectureship advertised here. So I applied for it and I got it. So I then became a lecturer. My PhD was on vaccines, and so I continued, not all the time, but on and off, working on vaccines. And then I was interested in skin, vaccination on the skin, putting vaccines on the skin. So you don't use injections.
Yeah.
And while I was interested in skin, I was reviewing a book on skin, and there was one chapter on nail. So I got interested in the nail to do research on the nail and make medicines for nail infections or nail diseases.
Brilliant.
And so I became a lecturer.
What made you interested in pharmacy in the first place?
That's very interesting because when I was about 5 or 6, my father said to me that, you will become a doctor. And I said, okay. I don't know what I didn't really think about it. It was quite a surprise. My father telling me when I'm like 6 or something, you'll be a doctor? Okay, I was like, okay, fine. And then as I became older, and I liked science very much. I liked biology. So it sort of fitted in with what my father had said, and I never forgot it. I even remember, like now, the moment when he said it. And so I was on my ambition was to become a medical doctor because that's all I knew.
Yeah. I
knew doctor means medical doctor. And anyway, so I had to try and get a scholarship because I couldn't afford to fund it myself. So I got a scholarship after A-levels, but the scholarship would not pay for medicine because medical degrees are much more expensive.
Yeah, because they go on forever.
Yeah, 5 years.
Yeah.
But they would pay for undergraduate bachelor degrees. So then I had to decide what to do. And it was quite difficult when all your life you've thought you were going to do medicine
Yeah.
to suddenly think, oh, I can do it, but I can't.
Right.
I can't because the funding won't allow it. So then I had to think of something else. So I considered a few things like physiotherapy, marine biology, speech therapy, because I didn't really have much idea. And my chemistry teacher, who went to University of Nottingham, told me, oh, go to University of Nottingham. And her sister is a pharmacist, so she said, oh, go to University of Nottingham and do pharmacy. And meet my sister, who's a pharmacist, and she'll tell you a bit about pharmacy. So I met the sister, the pharmacist, and then I thought, okay, I didn't really have a better idea of what to do. I knew I like medicine and I like medicines. I like the idea of drugs curing people.
Yeah.
So then I did pharmacy.
Excellent.
Yeah.
Good. Any regrets?
No regrets at all, actually.
If I did marine biology then.
Yeah, I would have been
And for
swimming
my
in the
second
sea every
career,
day.
Yeah.
Yeah. So then I did pharmacy, and then I did my training to be a pharmacist. And at some point, there was a PhD advertised here. So I applied.
Yeah.
Brilliant.
Excellent.
And I got
Cool.
there. Yeah. So no regrets. I think I'm probably happier in an academic setting than in a hospital setting.
Right.
Yeah.
Yeah.
Yeah, I get that.
Yeah.
And it's nice that you remember you talking to your dad about it.
Yeah,
it's lovely.
never forgot it. Yeah.
And there was nothing. You weren't like doing anything in particular that you thought, oh yes, I see
No,
that you're going to
nothing
be a
at
doctor.
all.
Anything.
He just came out of
You
it.
just eating ice cream. You're going to be a doctor, yeah.
Well, funnily enough, when my sister was born, she's older than me, first child. My auntie, my uncle married my auntie, of course, who was a teacher.
Yeah.
A primary school teacher, and this was a revelation to my grandma. Like, women teachers, wow! Women work, firstly, women have good jobs,
Yeah.
and women teach. So there was this tiny baby, and my grandma was thinking, oh, my baby, she will become a teacher.
Aww.
And my sister is a teacher now.
See? I just predicted over.
Well, she just desired it.
Yeah.
Because she thought that was the best thing.
Yeah.
There was no other better job that she could think of, because obviously this is like before the 1970s.
Yeah.
My grandma, who was born before 1940, her life, expectations of women was women just stay at home.
Yeah.
They work in the fields
Yeah.
and bring up the children. So suddenly there was a woman who had a job in her family, in her extended family,
Yeah.
and she thought, I want that for my granddaughter.
Yeah.
So, if you had to sum up why your research is important, would you be able to do that, please?
So firstly, vaccine is one of the biggest things that has changed our health. It prevents disease, and that's already a big thing, right?
Mm-hmm.
It prevents deaths. We have to be vaccinated so that we are protected. So it's not enough to have the vaccine there that the pharmaceutical companies make.
Yeah.
We actually have to take it so that we can protect us and our children. So I think vaccine is very important. Drugs, the same, saves lives, even if it makes us better, even, you get rid of your headache is a big difference, right?
Yeah. Yeah.
So medicines and vaccines are like some of the biggest things in the world. So I think that's just the feeling we have when we are ill and how we feel when we are better. It's a huge difference. I think
Very,
it's
very nice.
Important work.
it makes a big difference.
Yeah.
Thank you.
Certainly just to me.
So the other thing I'm doing is I was telling you about my fungus work, my work on fungal diseases. Not many people work in the field, and it's neglected. And I'm starting a network, a MyCall network, a Mycology Community of London network. So it's short for MyCall. It's long for MyCall. And we're going to launch it on the 3rd of February at the Crick. And so the aim is to get people who work in fungus to come together. They could be
brilliant.
clinicians, they could be researchers, they could be students, they could be the public who want to contribute to research.
Yeah.
And we will meet like 3 times a year, discuss ideas, to start collaborations, and just increase the work in the field. And collaborations will allow us to do more.
Right. Excellent. No, that's a great idea.
Brilliant. And
Yeah.
so it's being launched in February.
3rd
Yeah,
of February is a launch date.
Brilliant.
And it will be held at the CRIC
Yeah.
near St Pancras,
Yeah.
the CRIC Institute. And
How do people?
it's on Eventbrite.
Eventbrite.
So if you Google fungus, the CRIC,
That's what we
mycology,
do.
they will-
yeah.
people Google, right?
Just-
Everything.
Have you got the link that you can
I
send
will
to us?
send it
Yeah,
to you.
so you send it to us, so we can
Yeah.
make sure that we can put it on when we
Yeah.
tweet out about it. We can
Yeah.
do it. So, well, thank you very much for your time, and thank you for talking to us. It's been
Thank
great.
you.
Thank you.
Thank you. It's
And thank
been my pleasure.
Brilliant, thank you. Thank you very much to everybody for listening. We'll put links up on our website, which is antiwafflepodcast.wordpress.com, and our Twitter account, which is @antiwafflepod. Please do get in touch because we'd love to hear from you. Bye.
Bye.
Bye.